What will I gain from this video? After watching this video, you will be able to confidently assess the endotracheal tube tip position. Why is the carina important? Because the carina is the important landmark by which we gauge whether the endotracheal tube position is correct or not. How do we identify the carina on the PA X-ray? The first step is to make sure that the patient's midline is not rotated. Next, we identify the trachea. We focus our attention to the medial superior aspect of the mediastinum and identify the black rectangle. Next, we follow the right lateral border of the trachea inferiorly to the bifurcation of the bronchi and identify the superior border of the right main stem bronchus. We do the same on the left. Next, we identify the inferior lower border of the right and left main stem bronchi. We now follow the inferior borders of the main stem bronchi medially until they join together. This point is called the carina. If one of the main stem bronchi is not visible, the approximate position of the carina can still be established by following the inferior border of the visible main stem bronchus to the midline. How do we identify the carina on the lateral X-ray? To do this, we start with the PA X-ray, and we measure the distance from the superior edge of the aortic arch to the carina. We call this distance X. Next, we go to the lateral X-ray, and we identify the trachea. On the lateral X-ray, we now identify the superior edge of the aortic arch and measure from this point inferiorly using the measurement X obtained from the PA X-ray. This now takes us to the level of the carina. The tip of the endotracheal tube should lie approximately 5 centimeters above the carina. Now let's try identifying the carina in these example cases. In this case, we identify the trachea. We follow the trachea inferiorly to the superior border of the main stem bronchus. We identify the inferior border of the main stem bronchus and follow it medially. We now identify the top of the left main stem bronchus on the left. We identify the inferior border and follow it medially. Where the inferior borders intersect, that is the carina. In this case, we identify the trachea. We identify the left main stem bronchus. I have difficulties identifying the right main stem bronchus, but knowing that the position is approximately in this area, I can infer where the bronchus is. Or I can follow the inferior border of the left main stem bronchus to the midline, and this gives me the approximate position of the carina. In this case, we can identify the trachea and the main stem bronchi. We identify the inferior border of the bronchi, and where they intersect medially, this is the carina. In this case, we identify the trachea. We follow the trachea inferiorly, and we can identify the left main stem bronchus. The inferior border of the left main stem bronchus can be followed medially. We can identify the inferior border of the right main stem bronchus and follow it medially to the carina. In this case, this patient has an airway tube. We can identify the inferior aspect of the tube within the trachea. To evaluate and to confirm that this is in good position, we need to identify the carina. So we follow the trachea inferiorly, we identify the main stem bronchi, and we can clearly identify the carina point. This airway tube lies approximately 5 centimeters above the carina and lies in good position. So in summary, identification of the carina is an essential skill needed for safe clinical management of intubated patients. If you don't see the carina clearly, you can still extrapolate its position.